Hello there, and welcome to Health and Science. Let's carry on with the topic of illicit substances. So here I have some charts from the recent studies that was conducted in the European Union countries for the youth. As you can see, the numbers for Finland are quite good. On average, the Finnish youth use far less alcohol than in the other European Union countries, and only 2% of the youth have tried illicit drugs. When compared to countries like Denmark, the numbers are quite good for the Finnish youth. As well as if you compare to France, the number is also comparably lower. Also, when talking about illicit substances. So, this is good for you. Only 2% of the 15 to 16 year olds have tried illicit drugs, so it's a really marginal group. So let's talk about marginalization. Because we human beings, we are sensitive to what is considered normal by others around us. This is called conformism. And we avoid getting labeled as an addict because it is very crippling for an individual. And it will hamper greatly the quality of life. Nobody wants to get labeled and deemed unnormal. The studies have shown that smoking initiation and continued smoking has high prevalence among substance use disorder patients. But it is important to realize here that prevalence is not causality. So it doesn't mean that smoking tobacco will also lead to use drug abuse, but the prevalence is high. So usually people who are substance use disorder patients also smoke tobacco. So it's about social circles. So avoiding social circles that smoke tobacco is one good way to avoid also drug abuse. So signs of drug addiction. Here I have some general signs, and you have to realize that these are only very general and they can also relate to many other problems in life. So none of these signs are sure signs of drug abuse, but taking a look out for these can help you to help your friend. So first we have some behavioral signs which can tell about drug addiction. For example, unusual tiredness, insomnia, anxiety, and random outbursts of rage. These can tell that the individual is dealing with some hardships in his or her life at the moment, and they might be drug related. Also, increase in absences from school and work, and sleeping in a lot, and decrease in educational achievements can tell about some issues in life. Also, need to cover up a lot of things, and lying can be one sign. And difference in appetite, and also need of money and borrowing from friends a lot. So these signs might be a sign of a drug abuse problem. And also in physical dimension we have weight loss. If the individual loses a lot of weight in a short time, and neglecting hygiene, if he or she neglects hygiene and starts to change. Also, covering arms unusually. This means that they might have needle marks in arms, which raises suspicion, so that they might cover the arms. And also sudden changes in appearance, clothing, hair, makeup, and difference in body odor can tell about difference in life. Something dramatic is taking place in life. And signs of violence in the physical dimension as well. And then lastly, in social dimension, we have the changing friends circle. If the friends circle changes radically, it can tell about also that the individual is dealing with a drug-related problem. So lastly, about Finnish drug legislation. Because in Finland possession and use of drugs is a criminal offense, and the legislation varies a lot by country. In Finnish there is really strict legislation about drug use. A narcotic offense is punishable by fine or by maximum of 2 years of imprisonment. So it's good to know when you travel around that what is the legislation in the country that you're visiting. So now, as your homework, think about this. What would you do if you find an unused or used injection needle in the beach or somewhere else in a common place, in a public place? What would you do to it? Write down your thoughts and let's carry on from this in the class.